my pleasure to introduce our last speaker for the day, Dr. Radhika Santhanam-Martin. Radhika has been in a number of places, most notably in terms of our own community. She was able to spend a year and a half here as part of the early phase of our cultural consultation work, and currently is working in Melbourne, both with refugees and asylum seekers and with Indigenous communities. So we're very glad to be able to welcome her back, and her presentation is on othering spaces, uses of alterity in training and therapy.
Well, I'd like to begin by acknowledging the First Nation people, Indigenous people of Canada, on whose land we stay and work on this day. As you see, Lawrence is my co-author because I've been brainstorming so many ideas with him on this paper that it's only fair that I share the paper with him. But one of the things I want to thank, which I didn't quite expect in the script, was to thank Sushruth, who is my compatriot, because when the initial thing about writing about othering came about for me, one of the things that impelled me to do this was because I grew up in the land that had mastered the art of othering, which was India. And there are so many things to say about it, but the one thing I would say is just about a few months ago, I finished reading The Doctor and the Saint, which is the book he would know, but it's about Arundhati Roy has written juxtaposing Gandhi and Ambedkar. And in a way, I should have just done that book, unpacked the book, instead of doing an othering talk. But the reason I think why I'm interested in this space of othering, even between Gandhi and Ambedkar, is the fact that they were quintessentially the other to each other. So there was no dialogical space that happened. So the plea, I guess, in the talk for us, or the thing I want to argue, is that we must find a way to look and talk and create a holding space, which... so it goes back to Natasha's thing where the campaign where you use the same tools, you use the same images, and that's not the way we can do things anymore. If you use the same images and if you use the same language, then we get the same outcome. It may look very clever. So I think using exactly the same tools mean that we are doing the same process. You're othering while being othered. So it, positive or negative, I think we have to think about it more radically, that the ground clearing activity is to change the language of how do we use our language when we are talking about the other. How, so my thing is about changing the grammar of the language rather than just being more clever or strategic and using. So I quite agree when you showed the sheeps about, there was another advertisement or campaign where, and I think we do this all the time. We kind of use the same tools and same mechanism and somehow think that is not othering. We are othering each other all the time in similar ways. So the thing is to actually do a ground clearing activity and see how would this look otherwise. So I do want to, I'm not going to go into great detail about it, whatever you think about Paul Gauguin, my main thing is we cannot shut our eyes. That's not an option. So the idea is that we must open our eyes, and you will see how important phase is in this that I'm going to be talking about if we want to get the fragile tension of othering, so this, in any kind of, whether it is romanticizing the other or exoticizing the other or devaluing the other or idolizing the other, whatever we are going to be doing, we cannot be, we don't have the luxury to shut our eyes. I will not go into, I know there is a lot of we don't have much time. So I am going to be hurrying a little bit, so I'll leave a few things out. So the definition that I'm kind of working on is that it's an intersubjective process, and a lot of people have talked about it today, the whole day it has been. But the thing I want to highlight is that it has representations both in our own cognitive map, because of the history, but also in collective discourses in institutions and practices. Othering and alterity are seen as similar. Othering does occur in everyday human encounters. It can be normative or transgressive. It is certainly a recognition of difference. The key things to understand about othering process, it's never neutral and it's not unilateral. It's bilateral and it is not passive, whatever people may say. There is some kind of a thinking around, is this othering is does it have an evolutionary basis, as in, do we instinctively, we have the motivation and things to freeze or fight or flee and all of that, and also towards sex and affiliation and collaboration. I think what could be useful is to remember that the initial body reading and the comprehending is translated into more elaborate cultural scripts or narratives when we are talking about othering, which is mediated through language. So it's not simply a bodily reaction. It is certainly shaped by 4,000 years of oppression or a whole range of things. I did have an example where I wanted to give you about the Turkey time, but I think Natasha's example of reciprocal othering, as you other, you're being othered, or the impact of othering has been scarring both ways for the colonizer and the colonized, as Sushruth said, the perpetrator and the humiliated, and each one of us is potentially and literally other to the other. So I may not give the example because it was just a normal example I wanted to give, but I'll give you a clinical example later. There are many lenses you can bring to othering, and the lens I'm bringing today, and there are many people you can draw upon, and there are very scholarly people here who could talk about this in a much more wise way than I can. Certainly the four lenses that I'm drawing today is from hermeneutics and psychoanalytical, sociological and cultural studies. And hermeneutic certainly is othering is a reading or misreading of you by me, as simple as that. And psychoanalysis and the Jungian tradition, you heard quite a few people talk about it. And the sociological otherness is, I think, is in some ways Sushruth's thing, which is socio-political as well. And that's certainly the process of attaching statuses of moral inferiority or deficiency to socially marked differences. Cultural studies, on the other hand, which the field that I have been plowing through and at this moment most informed, is the subaltern studies and the studies of Orientalism, which Uzma also talked about, and post-colonial studies. Spivak certainly identifies four modes of being that create alterity. And it's interesting, Spivak's whole contribution in this field is very interesting. Anyway, the way she argues is that the four modes that create alterity are the nationalism, internationalism, secularism, and culturalism. So there is no ism that's left. So I do want to bring it back to my original discipline. I did philosophy as my major in graduation and then psychology. But I do want to bring it to both. So even though this paper looks more philosophical lens, my first thing at this moment is psychology, and I'm a neuropsych as well. And we have a developmental perspective saying that othering starts off as a profound process of differentiation. So as a child, unless you discover that the mother is not you, you cannot differentiate yourself. So the you comes first so that I can be located. The otherness is a prerequisite for self-knowledge. There are some wonderful experiments. How many of you here do Salian's marbles and theory of mind tasks? Anyway, there is wonderful social experiments to do with 2.5 and 3-year-olds who do not pass the theory of mind, which is basically, that refers the ability to infer about others. So it's like, can you imagine what Lawrence is thinking? Or you show an experiment, it's a false belief task of hiding marbles, and the 3-year-old cannot, because they think you can read their mind. But by the time they are 3 years and 8 months, they can clearly pretend. And they can clearly say, when the mother asks, did you eat the cookie? They'll say no, knowing I did, but she doesn't know that I did. So it's a very clear development that occurs. And it's a precursor to empathy and how we understand the mind of others, the opaqueness of others. And this is the start of intersubjectivity. How do I have empathy, and how do I develop empathy? So it usually comes around the age of 3, and one of the things I want to talk about empathy is also, because remember, when we are saying for the child that the child has to imagine what the other is thinking. So we, as a species, can do 6-order thinking. So I can imagine what Jaswant is thinking about her father, whose great-grandfather came in the boat, who was thinking of. So you can go level by level, you could do 6th-order thinking. But even the cleverest of animals, which is chimpanzees, can only do 2nd-order thinking. So we have this ability to deeply think through one's mind. And in othering, what's so clear is that we don't do that. We don't think deeply. We don't have a profound appreciation beyond. So one of Paul Keating, one of our Australian Prime Minister, not now, about 20 years ago, when he gave the apology to the Indigenous people of Australia, one of the things he repeatedly said in the speech, and if you're interested, it'll be on the net, he repeatedly said, we failed to imagine what it would be like if your children are taken, if your languages are stolen. We failed to imagine. This is very important for us in othering literature. What happens if you fail to imagine? What happens when the imagining goes away? And I think failure to imagine is a deep concept. Anyway, the forms of othering. Some of the exclusionary forms is what we have heard. We have heard about stereotyping, prejudice, racism, microaggression, whole range of things. And the health research particularly is very interested in studying exclusionary othering. Inclusionary othering, on the other hand, because remember, othering happens, it's a continuum. It happens both ways. Inclusionary othering recognizes the other in their uniqueness as an opening to allow for dialogue, empathy, engagement, and inclusionary othering, it can lead to consciousness-raising experiences or reflexivity of the participants or sharing of power or sense of community or relationship to the numinous, which is the spirit world. Or it can be both, but we don't have much data on how inclusionary othering happens. We have much more on exclusionary othering. I'm going to just also then now take you to othering as ethics, because I'm wanting to frame this as a plea for ethics, not for outcomes and not for evidence-based research or is this what we are doing to people, is this an ethical stance? So, and I do want to borrow Segalen, Hannah Arendt, and Emmanuel Levinas, not in any big way, given that it's 5:10. But the first one, Victor Segalen's, one of the major things, his words were, the understanding of others is always incomplete. So that's the recognition to reach. That, in his own words, otherness is not the perfect comprehension of what is distinct from ourselves. It is an acute and immediate perception of its permanent incomprehensibility. So this was, he predates Hannah. Hannah's, on the other hand, is very different. Hers is, she certainly connects ethics to justice and debates two regimes of rights, and she argues that the rights of the human is very different to the rights of the citizen. And the rights of the citizen comes by and for a social collective, and it's never translated to the rights of the human in a singular way. So for her, the solution of this was plurality is the one that will help us to trump the rights of the citizen to the rights of the human. For Emmanuel Levinas, on the other hand, it is not just representations and plurality, but what is really important, what will trump, is your actual encounter, the intimate, singular encounter with the face of the other. So for him, it was really important that we understand that the face of the other and the speech of the other that's all that matters. And for Levinas, it's also attached to fraternity, what he called the responsibility to the fraternity. What he implied by that was through the rights of the other and not by my own rights that fraternity arises. This relationship is reciprocal because my rights become meaningless unless there is an other willing to defend them. So he constantly talks about the responsibility that's there. And I'll come to that in a minute about how in the therapeutic stance it's important for, and how I apply it in terms of everyday work. But the failure of defending the other's rights, how would it look? That's how this would look. We've been talking about this is how failure of imagination and failure of defending others' rights. And we've got enough examples for that. In the clinical spaces of othering, I want to bring the two arms, and I do miss Ellen Coran, because a lot of what I'm talking about I first heard from Ellen Coran. I forget the political philosopher's name. Daniel Weinstock talked about false consciousness, because in everyday clinical practice, which is informed by traditional psychoanalysis, the man or the patient comes with a false consciousness. This is the assumption, and that comes with guile, and you'll have to slowly peel and reveal his own consciousness to him. So this is our tradition. It's not just the tradition of colonialism, it's also the tradition of all our therapy, that there is a tradition of suspicion. And so in the continuum of therapeutic hermeneutics, Ricoeur groups Freud, Marx, Nietzsche together as masters of suspicion, where the other comes with guile, and you have to work towards making them known to themselves. So, on the other hand, Ricoeur says, with Gadamer and Levinas, there is the other practitioners of hermeneutics who are based on trust and hope, who use encounter as a dialogical space where you can build hope and trust, especially if you can. Gadamer uses a German word, which is where it's a fusion of horizons. I can't say it, I practiced it. Horizon von Schmull, or something like that, anyway. Sorry for the German speakers. So when we were having the discussion, Lawrence and I, one of the things we were struggling is that the more relational psychoanalysts, somebody like Donna Orange and others, clearly argue that it's not just hermeneutics of trust or hermeneutics of suspicion, but you need both. You need to have a balance between doubt and or suspicion and trust. But what we were thinking was Levinas basically is also not just about that. He's also clearly proposing active participation and a bit of attitude of receptivity. He uses words like surrender in front of the face of the other, and kindness that comes a lot in his things. So one of the things we were grappling was that in the therapeutic space, what we actually need to build on the Levinasian ethics of responding to the face is that we need much more of a space which is open and gentle and ambiguous, tolerance for ambiguity, which Gaida talked about how there is no gray zone in our training, and I think we have to sit with that, a tolerance to one's own failings, a tolerance to one's own failings as one looks at the other's face, and as one is taken hostage by what the face demands. It's an invitation to a profound responsibility that speaks to a sense of humility. So that is what we are trying to argue, how that would look in a therapeutic space. I'm more than happy to talk a lot more on this tomorrow and day after, but I'm just going to keep going because I've got a few more slides. So in training, what would this look like? So usually the training format is about objectifying and decontextualizing, dehistoricizing and deauthorizing. So if we now say, okay, if this is how it looks and I actually want to open the space up, how do we undo the training format? Basically, I think we just undo by contextualizing and historicizing and authorizing and adding value judgments and addressing cultural safety. And a lot of others have mentioned. Because remember, as Foucault reminds us, the discourse or knowledge is never dispassionately circulated. So we have to take the responsibility to not to endorse difference blindness. So clearly say, I will take this on and I will open this space and I will contextualize it in history and culture and engage with it. There is so the play, I think, in training is to make these things more visible, to laying the structures bare so that people can face it and engage with it. And I think that is where our interest about hermeneutics of ambiguity has come from, where the implications for therapy, a lot of people have been talking about this. This is not the first time that people have talked about radical ground clearing activities in therapeutic spaces. People have talked about it in group, in individual therapies. And, you have a list of people. You've got Paulo Freire, who talks about it in education settings, and Bell Hooks, and Maturana, and Martin Barrow, Winnicott, Ricker, and Michael White, and Vicki Reynolds, narrative therapists. And so our ways of being, doing, and knowing in the relational context, if it should have Levinasian perspective, how would it look? What would we do? What would be our ways of knowing, being, and doing look? And where do those paradigms come from? One of the things Vicki Reynolds talks about is, she says about not justice speaking, but justice doing, and that our responsibility to continually find ways to be accountable to our clients, to tell them that these relationships matter to us and that they change us. Now, I want to give a clinical example. I will only take 10 more minutes. I want to give a clinical example of, I have a a young woman in mid-30s who has been in therapy for about a year and a half, single mother of 4 children, and from a context of multiple cumulative generational disadvantage from any lens, any angle. Currently in a very impoverished environment with several services, absolutely, monitoring and regulating and also supporting, I hope. So one of the therapy sessions, she says something about, I'm going to do a TAFE course, which is a technical college course. And I say, great, is that something you want to do, or something quite benign? My response was, oh, that's great. When do you start, or something like that? And she stops me and she says, you don't believe I do it. I will do it, do you? So I said, why do you say that? So she said, oh, it's written in your face that you don't believe me. And she says, I see my failure even before I've attempted in all the faces that I see. And I think these are very profound statements. How would our faces look if it was not showing the failures of the other? Admittedly, I'm not doubting that there are other projections happening there. But my issue is not about her. My issue is about me and therapists and us as to how would our faces look if it was open and kind. So one of the things I want to argue today is to say how in attachment literature, I'm an attachment practitioner and I train and teach attachment. One of the things we constantly talk about is these 3 pillars that are needed to build a relationship, whether it is a child or a student or a supervisor and supervisee. And we borrow on a whole range of Winnicottian things, which is a holding environment. We talk about kind face, safe hands, and being with. And we unpack again and again, what would being without look like? What's the limits of empathy? What would being and not doing? And what is being and what's being with? How different? So we go through this again and again, and what is a kind face and what is safe hands? And I think a lot of that is about holding the face of the other in a way that calls us to be accountable to the suffering, to hold and regulate and be attuned. The translation of difference into otherness is a denial of dialogue, interaction, and change. We heard it again and again today too, and we have known from history. So if we know that this is how denial of dialogue, interaction, and change, then we have to do dialogue, interaction, and change. So if we understand this, then how do we do dialogue? So the dialogue is a dual responsibility, admittedly, yes. But from the Levinasian perspective, but also Cecile Rousseau talks about it, she is clear that othering is not unilateral, and there is a need for mutual reciprocity in healing the wounds of ruptured representation. And although the duality is in the process is emphasized, the responsibility is not equal. So somebody is more responsible than the other for this engagement to happen. This asymmetric responsibility is certainly there, even though the process is duality, if that makes sense. And I think Jaswant also talked about reflexivity and how reflective practitioners, the change has to come only through reflexive positioning and reflective practice. So I'm going to end with a few things around this notion of tolerance of ambiguity and invitation to gentleness in the therapeutic space of holding the other. So it's not about the investigative and false consciousness and trying to peel the self to the other so that we reveal their self to them. It's an open-heartedness that allow us not to attempt to create the other in our own narcissistic image, but accept and receive and welcome the other. And we want to articulate a fragile tension between the ambiguous space and the openness to receive. It's an invitation to a profound responsibility. And I want to end with Spivak's thing that it's not a question of knowledge, it's a question, it's not a problem of knowledge, but it's a call for a relationship in terms of othering. Thank you.